Hello everybody, this is Dr. Grunman with Integrated Health Solutions. For our YouTube topic of the day, we're going to be talking about shoulder impingement etiology, or the origin of where it comes from. So a shoulder impingement, also known as subacromial pain syndrome, is a general sense of inflammation and decentration of the joint itself, which overhead causes a lot of pain. Now, where that pain generally comes from is either inflammation from the bursa sac on the inside of the rotator cuff, and it goes through this tunnel called the subacromial space. And that space is comprised of the supraspinatus and also that bursa sac. When the bursa sac starts to swell, it starts to compress when you get into an overhead motion, and it compresses into that supraspinatus muscle, causing a lot of referral pain down the arm. It could be presented locally into the front of the shoulder, but also into your upper traps, into the back of the arm, and then running down into the biceps and triceps sometimes too. So if somebody is feeling pain like that, we have 3 different orthopedic tests that are very specific into indicating that this is in fact that shoulder impingement. But also later on in the video, we will be talking about 3 specific exercises that are going to be excellent as a protocol for what you do on a daily basis to rehab it. So tune in, and I hope you enjoy. So you've been having some shoulder issues with overhead motion. This very well could be a shoulder impingement or what's called subacromial pain syndrome. There are 3 simple tests that we can do to indicate that this is in fact that diagnosis. So let's go through it together. The first test would be painful arc, bringing your arm to an oblique angle around 90 to 120 degrees if there's pain, and then it alleviates further up overhead. That is a positive test. Number 2 would be the clearing test. Hand on the opposite shoulder, pushing up toward the ceiling. If that's painful past 90 degrees, that is positive as well. Number 3 would be Hawkins Kennedy test. Arm out in front and internally rotated, pushing downward with the opposite arm. If that's painful and weak, that is also positive. And this could very well indicate that shoulder impingement or subacromial pain syndrome. This is Dr. Grunman with Integrated Health Solutions. Let's get you on the books and figure out a tailored plan for your shoulder care. Hey guys, this is Dr. Grunman with Integrated Health Solutions. Last week we talked about the shoulder impingement and how to diagnose it. Next step is to rehab. So for starters, we're going to do an exercise in a half kneeling position, putting a pad down to help protect the knee just in case it does get a little bit spicy there. I want you in that half kneeling position pulling the band apart just like so, but the important thing is to keep your elbows in relatively tight. And as you are bringing your arms up overhead, I want you to keep that constant tension on the band, feeling that engagement squeezing between your shoulder blades, and repping this out between 10 to 12 times. And as you are doing so, try to keep your traps disengaged, try not to shrug, keep your head tall. The next exercise is focusing on scapular engagement while you're laying on your belly. Finding a yoga mat, laying flat, bringing your elbows up from a side position, tucked into your sides. Keep your chin tucked so there's an elevation between your nose and the ground. And then bringing your arms overhead subtly, slow and controlled. This is not an exercise of speed, this is an exercise of control. So feel that engagement between your shoulder blades. And once again, as a reminder, keep those traps relaxed and rep this out overhead. If you need a little bit more of a challenge and this is too easy for you, take the band, pull it apart, and keep that constant tension on it. The last exercise is a staple at Integrated Health Solutions for shoulder issues. This is called the push press. So you're going to be laying flat on your back, holding the kettlebell upside down out in front of you. I want you to breathe low from your intra-abdominal region, so belly breath in, straight arm, drive up toward the ceiling, exhale, coming back down. Build that space between the shoulder blade and the table, and rep this out 3 sets of 10 to 12. At Integrated Health Solutions, we know that shoulder impingements are no joke. So book now to get started with your journey, and we'll get you taken care of.